Hey everyone, my name is Caleb Nissen, and I'm a third-year medical student at the University of Arkansas for Medical Sciences. And I'm here today to talk to you about our work entitled Measuring Resident and Faculty Contour Concordance as a Potential Tool for Quantitative Assessment of Residents' Performance in Target Volume Delineation Feasibility Study. So just a little bit of background. Accurate target delineation is essential for radiation treatment planning and the clinical efficacy of radiation therapy. And this importance has been demonstrated by numerous clinical trials. So it follows that quality improvement of target delineation is vitally important to the education of radiation oncology residents. However, as it stands, there is limited quantitative data on the quality of residence contours. Thus, it would be beneficial to have an objective measure to track the performance and improvement in resident target delineation throughout residency. And based on this, the purpose of the study was to determine the feasibility of tracking the concordance of radiation oncology residents' contours with that of their faculty physicians. So what we did for the study was residents were asked to contour target volumes based on patient history, physical exam, clinical stage, and fused diagnostic imaging. And they were allowed to use any available outside resources, including textbooks, review articles, consensus guidelines, and online atlases. Resident and finalized faculty contours were then saved as separate structures, and this data was collected from October 2019 through June 2020. The Boolean operations tool in Eclipse was used to create an intersection volume as well as a union volume of the resident and faculty contours. Intersection volume defined as the volume of overlap between the two contours, and then union volume is the combination total of the two contour volumes. And then, so based on these two volumes, the Jacquard concordance index was calculated by dividing the intersection volume by the union volume. Of note, other concordance indices do exist. However, the JCI was chosen because it was easier to calculate given the capabilities within Eclipse. So at the end of the study, 209 structures have been saved. Of these, 203 were able to have a JCI value generated. 6 cases, however, consisting entirely of small brain metastasis, would not allow for the calculation of the intersection and union volumes due to the fact that these volumes were too small for Eclipse to measure. In conclusion, tracking and comparing the concordance of resident contours and faculty physician contours is feasible using tools available in Eclipse. Additional data collection and assessment is necessary before this technique can be more widely utilized. And additionally, we have also analyzed resident and attending contour concordance from one entire academic year. This data has been submitted for presentation at the ASTRO 2022 meeting, so stay tuned for that. Yeah, that's it though. So I appreciate you taking the time to listen. If you have any questions, you can contact me here at this email or Dr. Lewis as well. All right, thanks y'all.